Hello, Dr. Greg here with part 5 of my series on exercise and your brain and dementia and old age and all that kind of stuff. So part 5 is all about cardiovascular health, which would be aerobic exercise. Cardiovascular and cerebral vascular, or brain, blood to the brain, okay, health is imperative for your brain to stay healthy. What they found is that they followed over 3,000 adults for about 25 years, and they discovered that elevated blood pressure and higher blood glucose levels, in other words, more sugar in your blood, actually causes a decrease in brain function. Less blood perfusion in the brain, the sugar tends to block the healthy blood getting to the brain so it can function normally. These individuals, over 25 years, they followed them, had a greater risk of cognitive or thinking impairment and dementia. Now, again, like I said, less oxygen to the brain means less function in the brain. The brain needs 3 things. We talked about this before. It needs oxygen, it needs activation, and it needs food, good food. Now, it's glucose, but that doesn't mean you have a table of sugar. It means it needs glucose from whole foods, protein, vegetables, that type of stuff. It doesn't need a shot of glucose, a teaspoon of glucose every hour to function normally. It needs to have a graded impact or a graded supply of glucose in order for it to function normally. So if you're going to deprive it of oxygen, which would be cardiovascular, cerebral vascular issues, deprive it of proper glucose, and deprive it of activation, the brain is going to suffer, and it's going to be reduced in its function, and it'll lead to dementia, cognitive decline, Alzheimer's, whatever. Now what's interesting, blood flow, okay, impacts several areas of the brain greater than other areas. Now, one of the couple areas that are associated, or the area associated with dementia, is the hippocampus. The basal ganglion is implicated in Parkinson's problems, and the cerebellum is implicated in balance issues. 3 things that elderly people, such as myself and all of us, some of us, have issues with. Now, what do you think if you reduce blood flow to those 3 areas? They're not going to function as normal as they should, and you're going to have issues. So it's important to be as active as you can be to allow blood to flow in, and also to think about what you're eating. Now, I know I haven't talked about eating. This is sort of an exercise rant, but aerobic exercise improves cardiovascular and cerebral vascular health. So to some researchers, it is intuitive, it makes sense that this will help your brain and help think better. What we need more research tying cardiovascular health with cognition and also decreased risk of dementia. Regardless of all that, it pays to be healthy for the rest of your life. One of the things that's interesting is that it takes time to be healthy. Now, taking pills, not necessarily make you healthy, but it's a quicker fix, right? Take a pill, oh, I feel better. I have a headache, I take a pill, I feel better. To actually eradicate that headache naturally takes a little more time. So patience is important. And that's something else. In one of my videos, I talked about patience and delayed gratification and how that actually helps your brain become stronger. So that's all for this week. We have a couple more parts to this video, to this series, and we're going to talk about what kind of exercises. I'm going to do a little review and wrap it all up, and then we're going to start something else. So this is Dr. Greg, changing the way we look at health.